Hi everyone. I ended my last video by beginning to tell you a little bit about how comfortable I was with the Cancer Treatment Center and how I felt like they were there for me to make sure that I was okay. My whole body, my mind, everything that I needed, they wanted to take care of me. And I felt so good knowing that was going to have a whole team of doctors looking out for me and guiding me on the rest of my journey. My first appointment was going to be with my oncologist. That appointment was scheduled for July 13th. July 13th actually had a very special meaning to me, as Friday, July 13th, 1973, when I was only 10 years old, my mother was diagnosed with throat cancer, and that was her first appointment to see her oncologist. And so I felt oddly comforted by the fact that I knew how well my mom did at a time when she wasn't expected to do so well. Her prognosis was not good, but she did great. She lived another 30 years after that and really did well. She always maintained a positive attitude. She never accepted cancer as being a death sentence. She just accepted it as something she had to face and that she would face. And she faced it probably more courageously than I could even imagine. So when I was told that I was going to be seeing my oncologist on July 13th, I felt oddly comforted by the fact that it was the same date many years later, and not a Friday, but nonetheless, July 13th. So I felt very comforted knowing that I was going to be okay, just like my mom. My mom always referred to Friday the 13th as her lucky day. Many wouldn't understand that because a cancer diagnosis, people don't see that as necessarily being their lucky day. But she knew that since they found it, she was going to get better. So she always called that her lucky day, and I'll always feel the same. I met with my oncologist on July 13th, and we sat down to go in detail about my diagnosis. My PCP had already told me that I had invasive ductal carcinoma, Nottingham grade 3. But I didn't know what that meant. And so as we sat and talked, my oncologist went into the details of what this diagnosis meant. And once again, this is a journey that's not the same for everybody, and so my experience with this may be very different than someone else's. But what she explained to me was that the invasive ductal carcinoma simply meant that it was a cancer that started inside the duct, the milk duct in my breast. And then she explained to me that the Nottingham grade 3 meant that this was the most invasive ductal carcinoma, as the Nottingham scale only goes from 1 to 3. She also explained that the cancer was not just in the duct, that it had actually broke free of the duct, and so that presents another issue. She was excellent at helping me to better understand the diagnosis, allowing me to ask questions, and helping me to move forward with what my next steps would be. I felt just very, very blessed to have someone who was so kind, so patient. I didn't feel like I was just a number, like I was just one of many people. I felt like I really mattered. I then went on down the road to see an endocrinologist. They had suggested the endocrinologist because, as I was telling you before, they didn't want to just take care of the cancer. They wanted to take care of me. And the endocrinologist was suggested because I have Hashimoto's disease, which is an autoimmune thyroid condition. And so I met with the endocrinologist. We did more talking about my Hashimoto's disease, how this is hormone driven, and talked a little bit about what I could expect as far as the future with Hashimoto's disease, maybe some things that we could try, and suggested that we review some of my labs that I had recently had. And so I sent her over all of the information on my most recent labs, and we discussed a little bit more about my diagnosis, and what we would do in the future was simply to continue to monitor my thyroid levels, to keep an eye on the nodules, the thyroid nodules that had been found, and also to keep an eye on my thyroid goiter. And I had a very nice visit with her also. Once again, very kind, very compassionate. And the next person I saw was actually a genetic counselor. It was suggested that I talk to the genetic counselor to find out if I had any genetic markers that might provide bigger concern. They wanted to look at my BRCA scores and also see if there was a genetic component to my cancer. Based on the fact that my dad had had cancer, he had had what they believe started out as prostate cancer, and one of my grandmothers had had ovarian cancer. There can sometimes be a genetic component to all of that. And so they really wanted to check and see if that was anything that I needed to be concerned about. So what we had to do first was go through some of my family history, talk a little bit about what I knew as far as cancers in the family, other medical conditions in the family, which I have limited knowledge. I don't know a whole lot about my dad's entire family, nor did I know very much about my mom's. So I really had very limited knowledge. But based on the information that I was able to give, they determined that I was a good candidate for genetic counseling, which meant that it was something that my insurance would pay for. And so we decided that we would go ahead and do some genetic testing. The genetic testing, what that turned out to be was actually a tube that they sent to me. And you actually spit into the tube and send it back off to the labs. They would be looking, I believe it was at 82 different genetic markers to see if they could find anything that would cause any concerns for my future or potentially something for my kids to be aware of. And so I sent that in, and it took, I believe, 2 to 3 weeks to get the answers on that. And everything came back looking really good. Almost all of my markers were negative. They did find 2 that they weren't positive, but they weren't negative. So they were just kind of in the middle there where there could be some concern, but not necessarily. And one of them was a cancer that normally would happen in childhood, and it's a blastoma, and I apologize, I can't remember exactly what it was called, but it does have to do with the eyes. Typically happens in children before the age of 5 years old. And so the concern would have been that that would have been something that I could have passed to my kids, which fortunately none of them experienced that. The other that was kind of iffy was a kidney cancer. And so, what they do with those tests, the ones that they're not 100% certain on, they actually continue to run different information on those. And eventually, I may get more information as to whether or not those are actually positive or negative. But for now, they'll just be there for them to continue to test until they have more answers for me. And again, the genetic counselor was wonderful. She explained a lot of things to me, talked to me about different decisions that could be made if they found out that my cancer did have a genetic component. We might want to do something differently. If it was genetic, we might want to look at potentially a double mastectomy. We also need to make sure that my family members, my daughter, that she knows. This is something that you need to be watching for. But fortunately, that was not the case for me. I also met with my surgeon who talked to me about potentially the different types of treatments that we could be looking at. The goal was to do a lumpectomy, but the way they would determine that was based on the size of the mass versus the size of my breast. And if there was enough tissue to actually do a lumpectomy, or if this would end up just automatically being a mastectomy. And so, based on the information and the size of the mass versus the size of my breast, she did determine that she felt like I was a good candidate for a lumpectomy. And I was really relieved to hear that. Not really out of the concern of not having a breast, but it just sounded easier. You know, we'll do a lumpectomy, it'll be nice and easy, and we just move forward from there. And so I was really pleased that that seemed to be the best option for me. I also met with a radiation oncologist, and the radiation oncologist talked to me about the fact that regardless of the decision to do the lumpectomy or whether it would have been a mastectomy, she said radiation would be the next step after the lumpectomy. They would do the lumpectomy, and then about 30 days down the road, we would be looking at doing the radiation. And I had a great experience with her as well. Very kind, very compassionate, very willing to take whatever time I needed her to take to answer my questions. And so, although I was feeling very overwhelmed with the multiple appointments and the contact, I had constant phone calls coming in, constant appointments. I felt somewhat overwhelmed by all of that, but I felt also very much at peace knowing that I was in good hands. They just wanted to help me. They just wanted to make me better. And they were going to take the steps that they needed to take to do that. They also offered me the option of meeting with a psychiatrist. I felt like I was struggling with my emotions, just that roller coaster of emotions, the ups, the downs, the waiting, the anticipation. I'm normally not an anxious person. I have never had significant issues with depression. Situational, absolutely. I've gone through situations that I felt sad, but nothing that was long term, nothing that I felt like I couldn't cope with. But they had suggested a psychiatrist. I did consider that, but then felt that I didn't really want medication to make me feel better. I really wanted to just talk. I just wanted someone to hear me and not prescribe any medication, not focus on all the negative, but I wanted to talk. I wanted to talk about what cancer was. I wanted to talk about other people's experiences. I wanted something different than what they were offering me. I have been sent information on different types of support groups. I was also offered many people that I could talk to that had had the same experience that I'm going through, knowing that, of course, everyone's experience is not going to be identical. But I thought that might be really good for me to have people to talk to. And I have spent a great deal of time talking to other people who have been through this. In some cases, it brought me a lot of hope. In other cases, people had very negative experiences. And there were times that I was fearful because of their experiences. But I just had to take the time to sit back and realize that not everyone's experience is going to be the same, and their experience won't be mine. I also know that I can get through anything. I've been through a lot of challenges. I've had some tough times, and I can get through anything. So hearing their experiences was great. Living my experience, I know it's going to be different than theirs. But I also know that if they can do it, I can do it too. And I will. As things progressed, we got closer and closer to making the decision on the surgery and actually going through all of that. I did have to make the trip to Goodyear, Arizona, to the cancer treatment centers, and again sit down and go over my diagnosis, my options, and then make the plan. I got there and actually had another opportunity to look at the reports to get a better understanding of everything, and for the doctor to actually take a closer look and determine if we could actually go through with the lumpectomy. The determination was made that it could be done, that it was very, very feasible, that once they got in there, they could just go ahead and get the mass and get enough margin around it. And as long as that margin was cancer-free, we were good. And so I left there that day knowing that within the next couple weeks, I would be in to get my surgery. I was, of course, fearful. I'm not ever going to tell you that I never felt moments of fear, because I did. But I just wanted things to move forward. In my world of cancer, every day felt like a week, every week like a month, every month like a year. And I just didn't like the waiting. So I set the fear aside, knowing that this was the beginning of making me well. We moved forward and scheduled a surgery date. And as the date grew closer, I went through a lot of emotional ups and downs. It's the unknown that's always so hard. And then we got to the week before the surgery, and my surgeon got a hold of me and let me know that they wanted, the day before the surgery, they wanted to take a closer look, because my information that they got from Kingman Regional Medical Center had indicated possibly a second tumor, but they weren't certain. Maybe it was just a shadow. And so I made the trip up, and the day before my surgery, I actually went in for another ultrasound. And they did the ultrasound, and the tech that was doing the ultrasound, there were two people in there, and the tech kept saying, "Boy, I just don't know. I don't know. I could see something, but I don't know." And so they went and they got the radiologist, and he came in and they began to look a little bit closer, and he was kind of guiding the tech on what he wanted to see. And Eventually he said, yeah, there it is, and it's real. It's not a shadow. There is a second tumor. At that point, what they did was they actually dropped a tumor marker into that tumor, and the tumor marker emits a sound that the surgeon can hear, and that allows her to be able to tell where it's at and to make sure she's getting both tumors and enough of a margin around it to get the cancer. The tumor marker, they let me hear the sound that it makes, and the only thing I could compare it to, the only sound that it made me think of, was the sound of a Geiger counter. And it was a very strange sound, but it was interesting to hear what my surgeon would be listening for as she did the surgery. They had some protocols that I had to follow, some special ways of cleaning and different things that I had to do before I could go in for my surgery. I also couldn't have anything to eat or drink after midnight, and so I was very careful to follow everything that they told me to do exactly when they told me to do it. I didn't want anything to stand in the way of my surgery. And so I got to the hospital the next day and was taken back and sat in pre-op for what felt like a lifetime. It felt like I was there for so long, just waiting and anticipating everything. And again, not really knowing what to expect. When you listen to the experience of others, you'll hear so many different things. You'll hear things like, having a lumpectomy was horrible. I was in so much pain. It was awful. You'll hear other people say, it was nothing. It was nothing. It was easy. And so I didn't know what to expect, but I went through the surgery. Everything went very well. The scar, I had two scars. I have one that's about so big, and that's toward the right-hand side of my left breast, which is where the masses actually were. And then I have another that is under the arm, closer to the armpit area, which is where they actually took out, it was either 2 or 3 of the lymph nodes that were there. They want to check the lymph nodes to make sure that they are clear of cancer. And so I had the 2 incisions, and I was bandaged up with huge, massive bandages to keep everything well protected and clean, and advised that after 48 hours I could take those bandages off. That would be the first time that I'd be able to see what was actually there. And so I left there feeling groggy, but basically feeling fine. They sent me home with pain medications and with some Tylenol. And I found that I really only needed the pain medication, the narcotic, only for about the first day, and the Tylenol only for the first 2 days. By Friday, I wasn't taking anything, and I had my surgery on a Tuesday. And I did great. The pain was minimal. I felt like I came through it really well. I was really pleased that everything went as well as it did. And my experience so far was good. I did stay at the Red Lion Inn. They had told me I could go home, but I'm 3 hours away from the cancer treatment center. And I didn't really want to come home and then have potential complications. And so I stayed at the Red Lion Inn, which is contracted through the Cancer Treatment Centers of America. Also another amazing experience. They really roll out the red carpet for you and make you feel very special. They take a lot of precautions because of the whole situation with COVID-19 also. And the next day we came home, and I felt really well. In fact, to the point after a couple days, I really had to watch myself because I didn't hurt. And so I had that tendency to maybe push a little harder than I should have, not be as careful as I should have. I had some weight restrictions that I had to constantly remind myself not to pick things up because I felt fine. And I was just really excited that things had gone so well. I was feeling so good and so hopeful. And it wasn't but a couple days. Actually, I believe it was the same day that I got home from the hotel. I got a call from my surgeon, and she said, "Jane, I'm really sorry." She said, I hate to have to tell you this, but she said, I really felt like I had grabbed enough tissue to get a clear margin. And she said, unfortunately, every margin, and there were 7 different margins that they were looking at, every margin had cancer in it. I was sad. I was really sad because I thought, one surgery and I'm done. She explained that she felt at that time that the cancer had spread, and we talked a little bit about my options, lumpectomy versus a mastectomy. And based on the information she had given me right at that moment, I really felt that the best option would be a mastectomy. I didn't want to take any more chances, and if this was spreading and it was as aggressive as they felt like it was, I really thought, my breast is not worth losing my life over. So I had resigned myself to the fact that the next step was going to be a mastectomy. And I was going to make the best of it. I looked into what kind of clothing I might need, what I could do to make things easier, and I started to purchase things to make this a little bit easier on me, to have what I would need, and to try to feel as good about it as I possibly could. I had told my surgeon that I didn't want reconstruction. I really didn't think I wanted to put my body through that. And she asked me, she said, would you be willing to at least speak to a plastic surgeon? I'm not trying to change your mind. I'm not trying to tell you what I think is best. But she said, I want you to make an informed decision. I want you to know your options. I want you to have all of the information put in front of you. And so I said, I'd be glad to talk to a plastic surgeon because honestly, I don't know. I don't know how they do this. I don't know what my options are. And I want to make an informed decision also. And so they sent me up to talk to the plastic surgeon. Again, it was a wonderful experience. I talked to someone who was so knowledgeable and so kind and compassionate, gave me a few different options, and also explained to me that this was going to be a 6 to 8 hour process, and that they could do it by taking fat from somewhere else in my body, maybe some excess belly fat, and they could put that into the breast. And then they would also be taking some veins, and they'd have to be reconnecting veins from what they took from my belly and put into my breast. And they went through the different complications with me, things that could happen. I listened carefully. I asked a lot of questions, and really wanted to take the time to kind of think through it. And so I took a little bit of time, and during this time, we also went ahead and scheduled my next surgery. I didn't want to wait too long if I didn't have to. And so we got the next surgery scheduled, and my surgeon had said to me, I'm going to need to know your decision on the reconstruction because that's going to determine the amount of time that we're going to need the operating room for. Because they do have to go through a different process, even though if I had reconstruction, it wouldn't happen at that time. There are some preparations that they have to make and some different things they have to do if you do choose the reconstruction. And so I talked to her and I said, I've decided I don't want reconstruction. I saw that as being something that was elective and not something that I needed to put my body through. I'm 57 years old. I don't really need that breast, and I don't really need to have the reconstruction. I was okay without it, and I had taken that time to think through it, and I was really confident in that was the decision I made, and that was where I wanted to leave it. My surgeon was absolutely whatever I wanted, she was okay with it. So the decision was made at that point, mastectomy, no reconstruction. She did say to me, now Jane, there's one more thing we have to do. Before we do the surgery, I'm going to need you to come in. We're going to need to do a mammogram and another ultrasound. We're going to want to take one more look. Okay, no problem. So the day before my surgery was scheduled, I went back and we went ahead, we did the mammogram, we did another ultrasound, and they sent another doctor in to talk to me. This was the radiologist that actually had found the second tumor. And he came in and he said, I understand that you have made the decision that you're going to have a mastectomy. And I said, yes, and I'm okay with that. I'm okay, I really am. And he said, well, I need to make sure that you know that you have options. He said, after reviewing this again, we believe that there's a 70% chance that we can actually get all of this without doing a mastectomy. We just need to get more tissue, and we feel confident, 70% confident, that we can get this without a mastectomy. 70% sounded pretty good to me. And so I said, great, then let's do that. I'd already had the lumpectomy. The process went really well for me. I healed really well. I felt fine. I had minimal pain. And so, great, we'll just do that. So the day before the surgery that was supposed to be a mastectomy, we decided we'd go ahead and just do what they referred to as a re-excision and just remove more of the breast tissue, and this time get all of the cancer. So the next day came and it was time to go for my surgery. This time I had already been through it once, so I was really pretty relaxed and just wanted to get it over with and be able to just relax another night in the hotel and then head back home. So again, the surgery went really well. No problems. The scar was a little bit bigger, but I was feeling really confident that everything was going to be fine. I got back home and the days kind of went on and I didn't hear anything from my surgeon right away, so I thought, this is a great sign. The last time it was within a couple days of my surgery, and this time I hadn't heard from her, so I thought that must be a really good sign. They'd call me if they found anything. So it's got to be good news. And that's where I kept my head. I just kept telling myself, this is good news, or I would have heard something. Every day that went by, I felt more and more confident that this was good news. and just looking forward to the next step of my treatment, which I believed would be radiation. They scheduled me about a week and a half out after my surgery to meet with my surgeon and my oncologist so that we could go over my treatment plan. And so I went for that appointment, again, still feeling really good. I was so positive that I was going to go in there and they were going to tell me, we got all of the cancer and now we're going to do some radiation and you're good. I was wrong. I got in there and my surgeon was the first one that I met with. And she came in, she sat down, and she said, Jane, I don't know how to say this except to tell you that the answer to did we get all of the cancer is both yes and no. That seemed like a strange answer. How can it be both yes and no? Well, here's how it can be both yes and no. They found cancer within less than 1 millimeter. So less than 1 millimeter, tiny, tiny bit, but less than 1 millimeter from the margin. That's not enough. So I said, well, what do we do? What do we do from here? And she said, well, we have some options. She said, I'm going to tell you, and you'll hear more about this from Dr. Lynch, who was my oncologist. You're going to have chemo. So you can either do chemo, the surgery, radiation, and then your hormone therapy that you're going to have to do, because this is a hormone-driven cancer. I'm not sure that I mentioned that earlier, but this cancer is estrogen positive and progesterone positive. So it is feeding off of the hormones. So hormone therapy was going to come into play no matter what. She said, or you can do another surgery, the chemo, radiation, hormone therapy. I don't know which way to go on this. I have no idea. And so I said to her, I believe that you and Dr. Lynch have probably been consulting on this since you were able to tell me that I am going to have chemo. I'm not the expert. I don't know how to make this decision. So what is the consensus? What do you believe is the best way to go? And she said, Jane, Dr. Lynch and I believe that you should have chemo and then the surgery, radiation, and then your hormone therapy. The reason we think this is the best way to go is twofold. One, we need to get your treatment started. This has turned out to be more aggressive than we expected, and so we need to get your treatment started. The other thing is you've had 2 surgeries, and we don't really know the end result of that. We need to give the breast some time to settle, some time to do what it's going to do to let swelling go down. They had already drained some fluid from under my arm and also from my breast. And so she said, I really think that we'll get a better idea of what we need to do once we can see what happens with the breast. So we feel that chemo, then the surgery would be the better way to go. Okay. Yeah, I can definitely go along with that because my biggest fear has been anything that would delay whatever treatments I needed next. So if that's what they felt was best, that's definitely what I'm going to do. I then went and met with my oncologist, And she explained to me that the way they made the determination that I would need chemo, because it wasn't something initially that I even thought was going to be a part of this. But when they did my first surgery, there's a test called an oncotype test. And that oncotype test tells them whether or not I'll need chemo. It basically gives them an idea of if this cancer could come back potentially in another part of my body. And based on your oncotype score, that's how the determination is made. And so if my oncotype score would have been lower, I wouldn't have to have chemo. But she said, your oncotype score is what we consider to be a high score. It's a 31, and you're going to have chemo. And she showed me a chart showing that without the chemo, I really only have a 20% chance of survival anywhere beyond, I believe it was 5 years. But with the chemo, I have a 90% chance. I don't want chemo. I really don't. But with those kind of odds, I'm going to do it. And I'm going to do it with a smile on my face, and I am going to make the best of this whole thing. But I'm definitely going to do it. So they explained to me that the chemo would be every other week. I would have to go to the cancer treatment center. They did give me options of having my treatment elsewhere if I wanted to be closer to home, but I've been so comfortable there and my experience there has been so good. I don't want to go anywhere else. I'll make that trip. I'll definitely make that trip. And so the chemo was going to be every other week for 4 sessions. And then I'd have 2 weeks off and I'd go back for a second round of chemo, a different type of chemo, every other week, again for 4 sessions. And they talked to me about the things that I could expect with the chemo, as many things have changed. There's been a lot of progress made in the diagnosis and treatment of cancer just as a whole. And so she said, Jane, you're going to lose your hair. More than likely, it will grow back, but you're going to lose your hair. I'll deal with that. And then she went on to tell me about other things that I could expect, maybe some bone pain. My immune system is going to be weakened. I may have some issues with maybe trouble stopping bleeding if I were to injure myself, potentially with being anemic. But she also told me that they do a lot of things to try to keep you as comfortable as possible, and that most people don't even complain about nausea anymore. The biggest complaint, she said, people tend to have is more around fatigue, and that has to do with the potential that you'll become anemic. So I did ask, can I go back to work for my own well-being, my mental health? Can I go back to work? And I explained to her, I work from home. I have for over 1.5 years now. That's not going to change. I've always worked from home for this particular job. I work from home, so I don't have to drive anywhere. I don't do any lifting. As far as I go is from my room to my office to my living room, my kitchen. I'm not out around people, so I'm not exposed to anyone where I can get ill, because there again, we've got to be careful. My immune system is going to be weakened by all of this. And after explaining my job and the fact that if I need to lay down and rest, I can rest. I'll get my hours in, I'll do my job, I'll do a great job, but I do have the flexibility to rest if I need to. they agreed to let me go back to work. And I was really happy to hear that. I think that will help me to be able to keep my mind off of some of the things and just move forward without thinking constantly about next steps. For me, keeping my mind occupied has helped me through this. I've taken a lot of time. I've done some reading. I definitely have done a lot of coloring. You can only color so much, though. And so going back to work was really exciting for me. I'm now getting ready to go up to the cancer treatment centers again. I'll head up tomorrow. And then on Monday, they're going to place a port in my chest. That port is what they'll use to put the chemo through. It seems to be a fairly, I don't know that simple is the right word to use, but for lack of better words, a fairly simple process. They'll put a port into my chest, and then that will be Monday. Prior to that, they'll actually do an echocardiogram. They need to make sure that my heart is strong enough to be able to take the chemo. As this we know with chemo that it puts your body through a lot. So they'll do an echocardiogram, and then they'll place my port. And then on Tuesday, I actually meet with my oncologist again. And then on Thursday, I'll actually start my chemotherapy. I'd be lying to you if I told you that I wasn't nervous. I am. I'm scared. But I've heard different sides of this. I've heard the stories about how horrible chemo is and how hard it is to get through it. I've heard the stories about people who have gone through it very easily. Regardless of how I go through it, I'm going to go through it with a smile on my face, and I'm going to go through it with the fight that I've had inside of me my entire life and the strength that was given to me by watching my mom go through this. Although I was only 10 years old when she went through her cancer, I remember how strong she was, and I remember how she knew that she was going to be okay. And I'm going to carry that with me each and every day, knowing that I'm going to be okay too. I'm going to be okay. And so I'm going to leave you for now, knowing that this journey, it wasn't something I ever would have thought I would have gone through. But it's something that I'm going to embrace, and I'm going to travel this path in peace and love, surrounded by the love and the support that I'm getting from so many people. I love each and every one of you. Until next time.